Healthcare failures leading to infant death. Nigeria's public health system continues to grapple with systemic breakdowns that turn preventable medical emergencies into tragedies, particularly for vulnerable newborns and their families. A recent incident has ignited widespread fury, underscoring how even modest fees can seal a baby's fate in under-resourced facilities. Amid these heart-wrenching stories, the broader crisis in maternal and child health persists, with incremental gains overshadowed by chronic underfunding, labor disputes, and infrastructure deficits. This is the story of newborn dies in government hospital over 8,000 naira fee. In a gut-wrenching viral video circulating online, a father in Nigeria collapsed in grief outside a public hospital after his newborn son died due to an inability to pay an 8,000 naira, approximately $5 fee for essential neonatal care such as incubator use or basic monitoring. The man, whose identity remains partially obscured for privacy, pointed fingers at Nurse Rose, a staff member he accused of callous negligence, allegedly delaying treatment while demanding upfront payment, despite the family's pleas. They said, "Pay first or the baby dies," and he did. He sobbed in the footage, which has amassed millions of views across social media platforms. This heartbreaking episode, reported in local outlets and amplified by citizen journalists, echoes a pattern of fee barriers in Nigeria's overburdened government hospitals. Similar cases have surfaced repeatedly. Mothers detained post-delivery over unpaid bills, or infants denied oxygen because families couldn't scrap together equivalent sums. Advocacy groups like the Wellbeing Foundation Africa have decried such practices as violations of human rights, arguing they exacerbate poverty's deadly grip on healthcare access. Online backlash has been swift and visceral, with Nigerians flooding comment sections with their own nightmares, stories of siblings lost to small fees during strikes, or rushed C-sections botched for lack of funds. Hashtags like "End Medical Extortion" and "Save Nigerian Babies" trended briefly, pressuring authorities for probes, though no official response from the hospital or health ministry has emerged as of November 14, 2025. While Nigeria has notched quite victories in immunization coverage, reaching over 80% for key vaccines like measles in urban areas per recent World Health Organization data, the nation still bears a disproportionate share of global maternal and child mortality burdens. In 2023, the country accounted for nearly 29% of worldwide maternal deaths, totaling around 75,000 women lost to childbirth complications, one every 7 minutes. The maternal mortality ratio, MMR, hovers alarmingly at 512 to 917 deaths per 1,000 live births, far from the UN's SDG target of under 70 by 2030. Neonatal deaths, often tied to birth asphyxia or infections treatable with basic interventions, claim over 250,000 lives annually. Exacerbating this are recurrent health worker strikes, the latest in 2024 by the Nigerian Association of Resident Doctors lasted months, crippling services in teaching hospitals and yawning funding gaps. Federal health allocations remain below 5% of the national budget, dwarfed by donor dependencies like the now suspended USAID programs, which funneled $423 million into maternal health from 2020 to 2025 before abrupt cuts. Rural facilities where 59% of births still occur at home without skilled attendants fare worst. Only 39% of deliveries happen in health centers per 2023 NDHS data. Initiatives like the Maternal Mortality Reduction Innovation Initiative (MAM2) and a $1 billion government pledge in March 2025 offer glimmers of hope, targeting high-risk zones with free C-sections and equipment upgrades. Yet, experts warn that without tackling root issues, child marriage, malnutrition, and conflict in the Northeast, these efforts risk stalling. Thanks for listening. This is Obedient Television.